Lab Medicine. Today we will continue our previous video on the topic of amyloidosis. In the previous video we talked about history, introduction and some basic concept of amyloid. Now in this video we will talk about types of amyloid, classification and pathogenesis of amyloidosis. So let's get started. So first of all, the amyloid can be functional and diseased. Now the functional amyloid, what is this? So in naturally the beta sheet fibrils are adapted to many purposes. For example, the polypeptide hormones are stored in beta sheet conformation. This can be found in melanosomes, silk and biofilms of bacteria. Now, as you all know, there are 4 levels of organization of proteins. The first one is primary structure. The primary structure is determined by the sequence of amino acids. Now, the secondary structures, which is braided sheet and alpha helix structure, it occurs when the amino acids are linked by the hydrogen bonds. Now, this forms into the tertiary structure when alpha helices and beta sheets are held together by weak interactions, as you can see in this pic. And the fourth one is quaternary structure. It consists of more than one polypeptide chain. Now there is a common feature in the altered conformation of the protein, that is, it is changed from the alpha helical to beta sheet structure, which makes the protein and aggregates resistant to normal proteolysis. The cause of this can be mutations or the defect in chaperones or presence of inappropriate proteins. Now in this pic, it is a pic showing the process of aging cell. In this case it is a young guy and this is a aged guy. Now some changes occur when ages increase, like DNA damage, mitochondrial dysfunction, dysfunctioning of protein quality control system and endothelial reticulum stress. Now in this pic, the mitochondria generates ATP, the misfolded proteins are corrected by chaperones into folded, and there is autophagy also and proteasome formation. So this process occurs in a young individual. Now in case of aged individual, what happens? There is endothelium reticulum stress. Now what happens? There is decreased formation of ATP, mitochondria gets destroyed, misfolded proteins aggregates increases, proteasome formation decreases, autophagy decreases, and the amount of chaperones proteins also decreases. Now this pic shows the mechanism of amyloid formation. So first of all, the misfolded protein, which is converted into folded protein by chaperones. It is a two-way reaction done by the chaperones. The misfolded proteins can undergo also degradation, or they can go under aggregation. If they can undergo aggregation, it forms oligomer, then it can form fibril, and then it can form a aggregate. Now in this graph you can show which is against aggregation versus time. So there are 3 phases: lag phase, growth phase and plateau phase. So in the lag phase you can see the oligomers are trying to form. Then in the growth phase the fibrils are increased exponentially, and in the plateau phase the aggregate are formed. And in the last pic you can see the formation of liquid droplets. Now the amyloid, as I told you earlier, also can involve many organs in our body. So in the brain it involves in the memory formation. It also involves in the hormone release. It also plays a role in skin pigmentation. Also has a role in neurodegenerative diseases. In the eye it involves as cataracts in the form of crystallines. In liver it involves non-neuropathic systemic amyloidosis. In pancreas it can lead to type 2 diabetes also. And in bone marrow the immunoglobulin light chain, that is AL, can be formed. The non-neuropathic systematic amyloidosis, AL, ATT and SSA, are located at the point where are they produced, but they affect multiple organs like heart and kidney. Now let's talk about the classification of amyloidosis. So in amyloidosis there are many types, but we have to remember few of them. Like first of all, it is AL, it is immunoglobulin light chain; AH, immunoglobulin heavy chain; AA, aposerum amyloid A protein; ATTR, transthyretin wild type. Next one is A beta 2M, which is beta 2 microglobulin wild type and variant type; APO A1, which is apolipoprotein A1 variants. And these are the target organs which affect by these amyloid proteins. So mainly AL, AH and AA affect all organs except CNS. These 3 have common feature that they affect all organs except CNS. Now there is a protein, A tau protein, which is tau and affect the CNS in Alzheimer's disease. Now these are the examples of predominant mechanisms that play a role in the development of most common amyloidosis syndromes. The first one is intrinsic tendency to fold into an amyloid structure. It involves these type of amyloid proteins: ATTR, APOA1, A-insulin, AANF. Second one is if there is excess production. In excess production we have 3: AA, AL and ACAL. Third one is proteolytic digestion. In this you have A-medin and AL. And fourth type is mutation, in which ATTR, APOA1, A-lysine and AL. Now let's talk about classification also. So the classification can be divided into systemic amyloidosis, hereditary amyloidosis, and localized amyloidosis. So in systematic amyloidosis, we have immunocyte dyscrasias with amyloidosis, known as primary amyloidosis. It involves the disease of multiple myeloma and other monoclonal plasma cell proliferation. The major fibril protein is AL, and the precursor protein is immunoglobulin light chain, chiefly gamma type. Second one is reactive systematic amyloidosis, known as secondary amyloidosis. It is involved in the chronic inflammatory condition. The protein is AA, and the precursor is SAA. Third one is hemodialysis associated amyloidosis, involves the chronic renal failure, and the protein is A beta 2M, and the precursor is beta 2 microglobulin. Now the second type is hereditary amyloidosis. The first one is familial Mediterranean fever, familial amyloidotic neuropathies, and systemic senile amyloidosis. So in this you can see the Mediterranean fever have A8 subtype, the neuropathies have ATTR, and the systemic senile is also ATTR, and the precursor of these is transthyretin. The third one is localized amyloidosis. The first one is senile cerebral, involved in the case of Alzheimer's, A beta type of protein, and the precursor is APP. In endocrine, we have medullary carcinoma of thyroid and islets of Langerhans. It also involves the type 2 diabetes also, and these are the proteins in carcinoma of thyroid: ACAL, which is A for calcitonin; islets of Langerhans, AIAPP, which is islet amyloid peptide; and the third in localized is isolated atrial amyloidosis, which is ANF, atrial neuritic factor. Now this pic shows the organ involvement in systemic amyloidosis. In brain, it can cause cerebral hemorrhage, stroke, dementia. In eyes, it can cause periorbital purpura, impaired vision. In mandibles, it can cause jaw claudication, xerostomia, and some mandibular swelling. In tongue, it can cause macroglosia. Or other causes you can see from the pic are hypotension, erectile dysfunction, dyspnea, cough, fatigue, anorexia, weight loss, hepatomegaly, hepatic failure, weight loss, and easy bruising, muscle weakness, nail dystrophy also. Now this flowchart shows the pathogenesis of amyloidosis. As from the previous slide, we have seen that there is a native folded protein. It converts into the amyloidogenic intermediate, that is misfolded protein. Then monomers assemble to form the beta sheet structure, and finally it forms a fibril. Now the production of abnormal amounts of protein can be due to acquired mutation and chronic inflammation. In acquired mutation, we have monoclonal B lymphocyte proliferation converted into plasma cells. These convert into the immunoglobulin light chains, and there is formation of AL protein. In chronic inflammation, there is microphage activation. IL-1 and 6 get activated into the liver cells, and the protein formed is SAA protein, and the final fibril protein is AAA protein. These are the precursor proteins. The third is production of normal amounts of mutant protein. The example, transthyretin. If there is a mutation, then it can form mutant transthyretin, and if get aggregates, it forms the ATTR protein. So that's all for today, guys. We will continue our video on the topic for the diagnosis and the investigations in the next. And up till then, please like, share, and subscribe, and press the bell icon for upcoming notifications. Thank you.